389 new Omicron infections reported by the Health Ministry last night, comprising 263 imported and 126 local. Daily Omicron cases could be 10 times more when an Omicron wave hits. That is 3,000 every day within a couple of weeks. Well, that's what Health Minister Ong Ye Kung told Parliament yesterday, given the variant's increased transmissibility compared with Delta. Associate Professor Alex Cook, Vice Dean of Research at the Swee Hock School of Public Health, joins me now. He specializes in infectious disease modeling and statistics. Welcome to the show, Professor. Professor, as at Monday night, there were 389 Omicron cases recorded. Now, Health Minister Ong Ye Kung said yesterday that once a wave hits us, we may see 3,000 cases a day within a couple of weeks. And in worst case scenario, 15,000 cases a day. What are your data projections and likely timeline?
Well, the number of cases being detected per day in countries of Europe is really quite phenomenal at the moment. It's about 3 to 4 times the number of cases that they had during their last winter wave, which was not too far off what our Delta wave looked like. And these are countries which actually have quite similar overall vaccination rates to what we have here. So that gives us a sense of how big the looming wave of Omicron could be when it hits us. It's striking, though, that when you look at France or the UK or South Africa and other countries which have got big Omicron waves just now, the deaths are far, far fewer than they were at analogous time points in previous waves that they experienced. And that's why a lot of epidemiologists are saying it's almost like the deaths and the cases are being decoupled in a way, right? And that the absolute numbers of deaths is fairly low to moderate, while the number of cases is completely off the charts. So when we look at Singapore, I think that we should really be expecting there's going to be a lot of infections in the community once Omicron takes off, probably quite a bit more than with the Delta wave. And that, just to remind you, peaked at around about 3,000 cases a day. Therefore, us hitting 15,000 cases a day, as Mr. Ong mentioned, is actually really quite plausible if our testing capabilities can continue to diagnose that many. I'm not confident enough to predict a number of cases because it's unclear whether we're going to have the same issues that some other countries, places like Australia, for example, are having in testing that many people around about the peak. And remember also that we don't count positive antigen tests as being cases unless they also get a positive PCR test afterwards. And it seems that then in places which have already peaked, so definitely South Africa, maybe the UK, it's taken about a month from the first upswing until it hits the time of the peak. And so presumably it's going to take a kind of a similar amount of time to ebb back down to lowish levels. Now in Singapore's context, it could be that we have a lower, longer, slower burn if we maintain the kind of measures that we currently have in place. And that, if so, would be better for the healthcare system, but it's probably harder for us as individuals because we want to get it over and done with. From how it's looking from some other places, I suspect that we will probably get a rise in ICU utilization and deaths compared to where we are just now, but hopefully not to the level that we experienced during the Delta wave due to two factors. The fact that it's not as severe as Delta was, but also because we've got higher vaccination coverage rates now. Despite that, although we're optimistic about what it will look like, we do need to be prepared to step up the ICU numbers if the epidemic seems to be growing more than we thought it would. Actually, the thing that worries me most is that right now is not really the number of severe cases that we're going to see, but actually more just the large number of potential mild cases in essential workers who are then all coming down around about the same time and having to take time off work. That's one of the eventualities that I really think we need to prepare for.
Professor, I just want to talk about the part where you say, it could be a slow, long burn of trajectory for us here in Singapore. Could there be a situation in which, say, the cases go up, it doesn't peak but it plateaus and then it just drops? Is that a possible situation as well?
So that potentially could happen, but if so, it would likely only happen if we are imposing specific measures around about the peak in order to blunt the peak. So in other words, it's almost rather than having a mountain, we have a volcano. It's certainly possible. But what I would anticipate is much more likely is that we will see a fairly sharp peak like South Africa has seen, and it will decay after that. And it will be only after that point that we'll get the kind of a stable number, probably with lower numbers of infections.
And on that, Professor, once the Omicron wave passes and case numbers stabilize, what can Singaporeans expect and hope for as we learn to live with the virus?
Well, I think if Omicron had not emerged when it did, then by now I would have expected many of the safe management measures that we got in place would have been relaxed. And assuming that there's no pi variant or sigma variant of concern or whatever, then I believe that the government can and probably should relax measures once the immediate threat of Omicron is passed. And you can kind of see that we're already doing that with the return to working at 50% capacity this month. Critically, pretty much everyone in the population has now either been vaccinated or had the chance to get vaccinated. And over the next few weeks, most people will be boosted, and most of the school kids are also going to have had their chance to get vaccinated too. So by the end of the month, then after Omicron has peaked, there's really not much reason to delay reopening. I know that we tend to take a very cautious approach to relaxing measures, but I would encourage the government quite strongly to be bold after Omicron has passed in how we reopen the country.
Professor, just to round up our discussion for today, hate to put you on the spot, but I have to ask, now that we are in the third year of the pandemic, your thoughts on how far we've come and how much further we have to go before COVID-19 no longer dominates our lives?
We're all getting sick of the pandemic. Quite a few countries were returning to life as almost as normal before Omicron emerged. And although some of those have dialed back on their measures a bit, for example, they require face masks in some settings that they had relaxed, then it still seems that normalcy is looming and it's just over the horizon. In Singapore, we've been fairly slow to proceed along that path. The government has taken what you'd either call a cautious or calibrated approach, depending on your attitude towards it. And while that has contributed to the relatively low numbers of deaths to date, I think it's clear that we're all getting really tired of maintaining this pandemic stance. And it's not clear epidemiologically whether once Omicron is out of the way, there's really any value to continuing to mandate how many people we can meet up with, or that masks be worn, or that people work from home, etc. And so I think that we should be aiming as soon as we can to be shifting quite rapidly to recommending behaviors to try to protect yourself if you feel that you're vulnerable, rather than mandating them to protect others, because others have mostly all been vaccinated already. And I think that will probably be once we're confident that the healthcare system can cope with Omicron, either because the local data has emerged and we're confident about how, what the overall severity profile is going to be in a Singapore context, or because it has already peaked and is only getting better from here on.
Professor Cook, thank you so much for your perspectives today. Associate Professor Alex Cook, Vice Dean of Research at the Swee Hock School of Public Health at NUS.